This is a differential case presentation by Rebecca Horno. The patient is a 70-year-old man with a history of congestive heart failure, chronic obstructive pulmonary disorder, and hypertension. He currently smokes 1 pack of cigarettes daily. His current medications is lisinopril, digoxin, and Symbicort that he takes daily. He currently is retired and lives at home with his wife that he has been married to for 30 years. He presents to the office with shortness of breath, chest pain, flank pain, and fever. Based on the patient's medical history, current smoking status, age, and symptoms, 3 different differential diagnoses have been made. These include acute renal failure due to glomerulonephritis, pneumonia, and a heart attack. Acute renal failure due to glomerulonephritis is most likely because it would account for all the symptoms the patient is experiencing. Glomerulonephritis is caused by an infection that could account for the fever and the flank pain due to inflammation. With renal failure, fluid backs up and can cause fluid on the lungs, leading to shortness of breath. With impairment of compensation by the kidney, an electrolyte imbalance would occur, causing the patient to experience chest pain. Next likely would be pneumonia, which would account for 3 of the 4 symptoms. As the infection develops in the lungs, it would account for the fever, shortness of breath, and chest pain. Finally, the heart attack is always a possible diagnosis with any individual experiencing chest pain. Initial diagnosis in week 7 included pneumonia, lung cancer, and a heart attack. For week 10, 2 out of 3 diagnoses stayed the same with pneumonia and heart attack. The difference between the weeks was taking away lung cancer and adding in acute renal failure due to glomerulonephritis. Upon further research and education, acute renal failure due to glomerulonephritis was a better fit for the patient's symptoms than lung cancer. The other 2 diagnoses are a good fit based off symptoms and patient history. The first and most likely diagnosis is acute renal failure due to glomerulonephritis. When a virus is introduced into the human body, the body makes antibodies. The antibodies bind with an antigen, forming a complex that can be lodged in the glomerular capillaries in the kidney. This causes slowing in the capillaries, leading to congestion and decreased glomerular filtration rate. The decreased filtration rate stimulates the renin-angiotensin-aldosterone system, leading to retention of sodium in water. Continued impairment of blood flow leads to acute renal failure. Acute renal failure happens when the kidneys are no longer able to filter properly, leading to buildup of wastes, decreased urine output, and fluid retention. The buildup of waste causes further kidney damage. With increasing failure, the body loses the ability to control the acid-base balance, leading to electrolyte imbalance. Hyperkalemia leads to heart arrhythmias that could be the cause of the patient's chest pain. With fluid retention, the lungs start to accumulate fluid, causing increasing shortness of breath and potential chest pain or a burning sensation. The second potential differential diagnosis is pneumonia. According to the National Heart, Lung, and Blood Institute, pneumonia is a bacterial, viral, or fungal infection of one or both sides of the lungs that causes the air sacs or alveoli of the lungs to fill up with fluid or pus. Either bacteria, fungi, or virus enter the respiratory tract through the nose. This causes inflammation and congestion in the alveolar wall. Inflammation causes a buildup of either fluid or ectudate within the alveolar sac. Buildup leads to decreased functioning of the alveoli, leading to shortness of breath as well as potential chest pain. Proliferation of bacteria causes fever. The third potential differential diagnosis is a heart attack. This occurs when the blood flow through a coronary artery is blocked by either a thrombus, vasospasm, or an emboli. The most common cause of a heart attack is due to thrombus formation in a person with atherosclerosis. The formation of lipid plaques in the arteries cause narrowing of the lumen. Once the thrombus gets big enough, it causes a blockage in the artery. When the entire artery is blocked, oxygen supply to the heart muscle ceases, leading to ischemia and cell death in the heart wall, causing chest pain. If the issue is not resolved, the heart's productivity is decreased, leading to a backup of fluid systemically in the lungs. Fluid on the lungs causes shortness of breath and adds to chest pain. If the kidneys fail due to decreased perfusion of blood, there is a decreased urine output and accumulation of wastes. With accumulated waste, there is further inflammation leading to flank pain. This patient is at an increased risk for multiple disorders. Just by being elderly and going through the aging process puts him at a higher risk. These complications of aging will be discussed on the next slide. For acute renal failure, this patient is at an increased risk due to aging, history of hypertension and congestive heart failure, as well as being an everyday smoker. With pneumonia, patient history of congestive heart failure complicates lung function and leads to fluid buildup in the alveoli. COPD already disposes the patient to having issues with the alveoli. Being a smoker irritates that respiratory tract issue, leading to vulnerability to infection. For the diagnosis of a heart attack, this patient is at an increased risk because congestive heart failure and hypertension, which means the heart is already working harder. Smoking daily puts a strain on the heart muscle. The patient has used digoxin daily, which shows that he or she already has been seen for chest pain or a heart attack, which increases the patient risk of having another episode. With aging, kidney function is reduced due to loss of glomeruli and degeneration of tubules. This leads to decreased ability to process wastes and fluids. The muscles in your heart are incapable of replicating, so loss of any heart muscle results in decline in functionality. Collagen and fatty tissue buildup in the heart leads to decreased conductivity. The skin and mucous membranes become thinner and more fragile, causing an increased risk for infection and decreases healing times. The lung elasticity decreases, leading to decreased inspiration and expiration. There is also a decline in the amount of red blood vessels supplying the lung, leading to decreased perfusion and gas exchange. The most likely diagnosis is acute renal failure due to glomerulonephritis. The patient is elderly, leading to decreased function of the respiratory system, increasing risk for infection. With decreased kidney function, there is a decreased regeneration rate and a higher prevalence of infection. This is the most likely of these three differential diagnoses because it accounts for all the symptoms the patient is experiencing. The history of hypertension and congestive heart failure places this patient at a higher risk for kidney dysfunction. A history of congestive heart failure already puts a strain on the patient's renal system, therefore could potentially already be causing issues for the patient. Current diagnostic tests for glomerulonephritis would be blood tests, including urea and creatinine, to test for the glomerular filtration rate. Other blood tests include anti-DNase B, strep antibodies, ASO, and ASK, which in this case all would be elevated. Complement levels are decreased. pH is lower due to decreased serum bicarb levels from inability to filter through the glomerular capillaries. Urine analysis will help to determine if there is an infection, and a urine culture will help determine the organism responsible for the infection. Treatment consists of treating the underlying cause, which in this case is very likely due to an infection. Treating with an antibiotic that will stop the infection from progressing. Decrease sodium water intake to decrease edema in the tissues. This may help with the chest pain and the shortness of breath. They may need a diuretic to help get rid of excess fluids. Steroid treatments to reduce inflammation and antihypertensives to decrease blood pressure effectively, decreasing the load for the kidneys. Dialysis may be necessary if the damage is severe enough in order to restore homeostasis. Being in the women's health nurse practitioner track, kidney failure is not something that one comes across on a daily basis. If this patient came into the women's clinic, I would refer them out to their primary care provider or urology for further evaluation and treatment. References.